Query from Delhi, India. Because of small clinics, patients underestimate my skills. Okay. The question is, how do you come to that conclusion that patients underestimate your skills because of surface area? I started in a 10x7 clinic with a second-hand chair in the year 2000. The clinic that was supposed to be opened by a friend, he had bought that setup. He had shifted to that place. He was supposed to shift with that chair, but somehow you can say, shifted to that. But in less than 3 years, my new clinic was ready. And within 6 months of opening up, I shifted to full-time practice also. In the beginning of my clinic, I was doing only practice in the evening for the first 3 years. But by 2.5 years, my setup was ready. We shifted after exactly 3 years. 1st Jan 2000, I started clinic. 1st Jan 2003, I shifted to my new clinic. 15th June 2003, I shifted to full-time practice in less than 6 months. Never had that adjustment period. And trust me, that period of mine was pre-MBA period, when I didn't have knowledge of all these things. I was as naive as you guys, most of you. So space constrained, if you equate with skills, I'm not sure that is a right comparison to make. People have thrived well in smaller clinics, and people are sitting idle in bigger clinics, if space was the concern or skills was the concern. A larger clinic or a bigger clinic does not automatically guarantee that you will have a good skill set. So I'm not sure what makes you make that comparison. So whenever charges are increased, patients think that we have increased the charges unnecessarily. It is your thought process. In the post-COVID world, trust me, increasing charges has been like a cakewalk. I personally can tell you from those experiences, if you are doing it or not, I'm not sure. But before COVID, we had a few issues in raising prices every year. We used to face some kind of, you can say, protest. I won't say protest, but some kind of, you can say, indifference from the patients. But post-COVID, people have understood that the world is inflationary around us. They have changed so many things in their sterilization, hygiene, and other protocols. So everything comes at a cost. And everything is rising, you can say, each month. Car prices of Mahindra has risen 3 times. January में सब car prices बढ़ाते हैं. Mahindra ने January में बढ़ाया, April में बढ़ाया, May में बढ़ाया. And they are planning again near Diwali. And फिर New Year पे फिर बढ़ाएंगे. So that makes it 5 or 6 raises in one calendar year. Have people stopped buying those cars? No. Rather, there is a surge in buying Tata and Mahindra cars than before. Because they are make in India, one. Second, they are supposed to have a robust build than Maruti, which is coming out with paper thin metal. कहाँ से लाते इतना पतला metal पता नहीं. Paper thin metal, they are famous for these days. No crash test being done. Now people question them. This is the best time to increase charges. You have faced no indifference, no protest whatsoever. People understand सब कुछ तो महंगा हो ही रहा, तो ये भी महंगे हो गए तो क्या हो गया? Understand. Have to adjust with everyone, patients as well as assistant, as if we have created a big crime after becoming doctor, have to bow in front of everyone. I'm sorry, I don't agree to that. If you don't set the rules, if you don't set your boundaries, if you don't set your limits and your rules, people are going to take you for a ride. You have to understand where lies the problem. If you have not set those boundaries, set them. Make sure it's my way or highway. You don't need to bow in front of anyone. It's not a crime being a doctor. Not too long back, we were considered the next ones after God. So understand that and value yourself first before others can value you. If you think of yourself as a criminal, that being a doctor is a crime or I am a criminal, then people are not going to respect you. So value yourself first before people can value you.